Então, agora,
So now we will begin this important moment talking about a topic that's very interesting for many of us. I'd like to recall you who is a public servant and asked us about attendance lists. Your badge is already the proof that you are here. And after the event at the Freemind website, we will send you a link for you to print your certificate, okay? So let's start. My teenage son does not want to talk to me anymore. What now? Silence in teenage years can also be a cry for help. This panel addresses family ruptures, emotional fractures, and practical strategies to restore dialogue based on scientific evidence, clinical experiences, and educational and community practices that have been working out well. I'd like to call the moderator of this parental skills panel, Professor Dr. Fábio Simas. He's the director and partner of the Christian School Agregare. He has a BA in Portuguese and English. He has an MA in letters and in PhD in letters from the University of Fluminense. He has an MBA in financial management. He's worked as teacher, administrator, and supervisor in different institutions and schools. He's also a pedagogical coordinator at Alfabeto Institute. He is a teacher, a professor of Portuguese language. A round of applause for Professor Fábio Simas. Good morning, everyone. I hope you're well. Thank you, Marcelo. I will open here my paper because we also need some note taking. This is a very important panel. Today we've been talking about parental skills a lot. And I see that in the reality of schools where I go, parents sometimes are lost with no guidance because they can't truly reach the hearts of their children through communication. Without further ado, because we are a little bit late, I will do the opening and call to the stage the stars of this panel. So, contemporary world is fluid and challenging as time goes by. Transformation is fast, and relationships are not a part of that. From that, we live the era of hypercommunication. Internet has expanded our reach, shortened distances, facilitated meetings and negotiations. However, as a paradox, it uh, took apart those who are present. In this scenario, teenagers who are forming their identity both socially and emotionally, they are in a complex environment and contradictory environment. The the so-called volatile, uncertain, complex, and ambiguous world gives place to a fragile, anxious, nonlinear, and incomprehensible world. In view of that, a certainty remains. Communication is the basis that sustains life in the community and makes it possible healthy bonds. That's why we're here today with four experts that will help us to understand how that communication or the lack of communication has been manifested in our relationship with our teenagers. So, a round of applause, please. I will call today's speakers. Dr. Alessandra Calisto, please, a round of applause. Professor Luciene Alves. Natalia, I'm sorry about my pronunciation. Zakartsi, she's our international guest. And Sueli de Souza, a round of applause for them, please. Take your seats, please, wherever you wish. Without further ado, I will introduce our first speaker. We'll have 20 minutes, okay, girls, for each one of you to give her presentation. I don't need to speak in English. Okay, she has translation. Great. Okay, okay, she has a phone. Okay. So I will I'll call our first one, Dr. Alessandra Calixto. She has a PhD in nursing from Federal University of Rio Grande do Sul. She has an MA in health teaching. She's an expert in parenting education. She's an expert in drug addiction. She's an expert on mental health from Rio Grande do Sul Federal University. She She's an expert in health management from Federal of Rio Grande do Sul. She works as a consultant nurse on chemical dependency at the nursing service in the Hospital de Clínicas of Porto Alegre. She has experience in the fields of nursing, mental health, with emphasis on psychoeducational groups and family education. You have the floor, Dr. Alessandra. A round of applause, please, so that we make our panel very warm. It's okay, so, okay. Can you all hear me? Thank you very much. I'd like to thank you for inviting me, especially Paulo Martelli, who made a huge effort for having us here and invited us so gracefully to this event. Now, I've been working as the chair of the Brazilian Association of Studies on Alcohol and Other Drugs and as a professor at the Federal University of Rio Grande do Sul. So now I will address some general issues that we have been studying regarding parental skills. As it has been already said, and we all know, at this moment, this silence and emotional distancing may indicate a vulnerability that does not portray not only the problems that we live throughout this historical period in which internet and electronic devices occupy our time intellectually as well and in our relationships. But we believe that just like other behaviors that come from crisis, such as the pandemic that affected our mental health and continues to affect throughout a few years, it's kind of a wave movement. This crisis that we have been experiencing for a while, not slowly established, but in a fast way due to easy access to electronic devices and all the platforms it gives access to, will also affect our behavioral and our biological, social educational point of view, and etc. We do not have the full dimension of how this our current lifestyle will impact us. We have ongoing studies that kind of anticipate what may happen and tell us what behavior should we adopt now to kind of halt the consequences of our lifestyle and also in the way we work. Our relationship is not changed only within our families, but our relationship with work has changed as well. I believe you have personal experiences in which in the past, like 10 years ago, we didn't have full-time dedication as we have now to our work. It seems like we have been captured by our intellectual activities, by our everyday jobs, which we used to have routine, but now we have a situation of hyper connection with problems and excess and need to be creative and productive all the time. Teenagers and children are also suffering this pressure of having to be creative, productive, of not being allowed to express their emotions or to have crisis or a difficulty to help them in their process in their growing process because we experience a generation of adults who are around 25, 30 years old and they are emotionally immature and also neurologically immature due to being the generation that was overexposed to access to electronic devices. So the children that from the 1990s that started to have access to these devices and also the entire issue of relationships, which it's natural to change over time, but children do have these parents who are still developing relationship related skills. I believe you are following experts, psychologists, and doctors, and etc., updating us regarding the fact that teenage years is now up to 24, 25 years old. We have delayed that period of emotional maturing, but it's proven that neurobiologically it's at 24 years old. So society helps us in some behavioral processes or not. The way we are organized as a society at this moment has not been favoring us. So today we are gathered in this Freemind Congress to discuss these parental strategies that are based on evidence for this moment we are experiencing. So, teenage years and silence. They have neuropsychological and social cultural basis. So we must understand that a teenager's silence reveals not only a need, but also a relationship that was established with its environment. The relationship of risk regarding the use of substance, risk increase at this phase of development, and we know that. And for the most of us who are parents or who have already been teenagers and tested our parents, that's when the relationship crisis began. So we must have parental models that are more structuring.
Late maturation of the prefrontal cortex. So we have this prefrontal cortex area that we know matures slower, and it's a novel area, prime area of our brain responsible for regulating our impulses and helps us in several complex connections, interpretations of reality, interpretations of our emotions, in several abilities and skills of emotional contingency and control. Because this area is still under development, possibly the environment will affect this environment, and the environment, due to its setting, the space setting that this child teenage has, will also relate to that environment or other environments in a very interdependent and subjective, complex way, causing certain changes of behavior, reaction to environments that can caught us unguarded. And we use our educational basis, cultural basis, and our historical time of maturing to have a relationship with a teenager that today is completely different, exposed to situations that are completely different that we were when we were teenagers. So we need to be tolerant, patient, and train our skills in the sense of strengthening some skills that we already have as adults. And we need to be adults for these teenagers full time. Here, I'd like to tell you that, as I said, from 12 to 25, we have the complete closing of this mechanism of regulation. But our brain never stops developing. Some structures are more mature and give us conditions of regulations. So our brain is always under development through stimuli, experiences, our relationships, our emotions, through all of that, because we are always subject to cortisol, stress, our lifestyle, what we eat, how we live, where we live. All this impacts our entire life, the development of our brain, of how our brain will behave itself. So it's a very complex relationship. So there's a series of stimuli, environmental, emotional, relational stimuli that impacts how we will react our complex cognitive relationships. Those complex cognitive relationships also determine certain things. And I say this because the teenager uses an adaptive defense. He tries to be independent, he makes independence attempts, and he conflicts. He goes within, he tries to conflict, he tries to fight with us so that he can self regulate. And if we're not able to help him self regulate, he will be alone trying to find this self regulation. And this can be through a relationship with some type of substance. Some not even try to find self regulation because even before this need of self regulation, and Dr. Lotufu is here to who will bring to you several experiences or any. I'm also a teacher, a professor. Any teacher or professor would tell you that before the need of self regulation arises, the substance will already emerge or stop being used or within this teenager's house or the electronic device with a very strong response to these needs. So there's a lack of circuits to generate the need for searching. And also very important is that today's teenagers, they have a very huge emotional overload that they bring to us within our visits, family visits, health services, schools, clinics, and teachers. Those who have a more close relationship with children and teenagers have noticed that this these problems, relationship problems, but attitudes of pseudo maturity. So children and teenagers still not being able to self-regulate very well. They look for figures, they look out for figures to take important decisions for their families because their families are also hyper connected and are not able to make very basic decision of for their livelihood, their family livelihood. So we have this digital culture which brings this this emotional comfort, and of course this will naturally leads to isolation in this age. Most recent studies have showed that there is this reduction of communication within the family and the intrafamilial communication, not only because of the disconnection caused by the electronic devices, but many qualitative and broad and repetitive studies, repetitive in several realities and cultures, have showed that parents are not able to keep pace of the lives of their children and teenagers to talk to them. For example, I have a 20-year-old son. When he was younger, he really liked read manga, see manga. Everything about Japanese culture was very attractive to him. That's not a reality of mine. I mean, I had access, and and he had access through his cell phone, and then he started accessing through streaming, and I didn't have much to talk to him about that because I mean, even the characters that he liked, I wasn't even able to pronounce their names. It was all Japanese, so I need to actually go take a manga course. My husband and I take a manga course, and then when Netflix began, we started seeing manga with our child and take ownership of that also so we could talk to him because they have access to so many things at the same time of very diversified cultures, and that's very different from the very traditional education that I was brought up in, more linear education that I was brought up in. Today education is not linear. It's multicultural, it has several faces, several fronts. So we really need to make an effort to understand this, the language of play games, for example. My students, they are also 20 at university. So last week, I gave a class instead of researching for scientific studies, which is what I, Dr. Lotufo, Silene, Professor Fabio had to do when we were 20, a search for scientific studies. I left a data bank open, and the class was about examining mental states. So I get the last 5 year Marvel movies, and I started making a mental map of the Joker. We discussed Batman's risk behavior. We discussed, I don't know if you ever heard of Demon Slayer, but Demon Slayer is a series. We discussed the risk behavior of the characters there. We discussed Attack on Titan's social political relationships that led to some emotional issues. So I would show scenes of this movie series, and then based on that, I would go to the articles and say, so now you have to read this article because this article is related to that what we talked about Batman. You see what I had to do? So today, students they listen less at home at our class if they're not entertained because they are 24/7 connected to the cell phone. So this resort they make, this comfort place they are always seeking, is something that we have to reach. So uh, when you have low parental skills, you may have the early use of alcohol, tobacco, marijuana, the harmful use of these substances, the harmful use of electronic games because it's very self-reinforcing and dependent on the internet. So we know that some meta-analysis of these last 5 years have shown that parental skills and monitoring and positive not monitoring have been associated to the likelihood of reducing a lot the use of substances or making its use happen later in life. So no, that's not new data for sure. It's not new data, but what I still want to tell you is that when I started studying alcohol and drugs, we had this reference already. We already had this knowledge, but it's still monitored. Presence, attendance, connection, being present and connection is still what makes this use later in life. So, restricting opportunity, promoting bonds, and the normatization of behaviors that are protective behaviors. All these behaviors tend to reduce isolation and also impact, like what the study shows, that the more activities at school of connection with families you have, and also the families not only with the school community, but also outside of the school community, this interrelationship with the external community, it reduces low performance of school, reduces school evasion, and teenagers and children that have greater pattern of disconnection with the school learning system end up connecting, not because they necessarily like to study, but because they connect to a purpose, to a collective purpose of self-development. You see? So when we as a community, as a school, are able to create a culture of connection, not only person to person connection as how we were trained to do, but the connection of a purpose, a culture of purposes, of self-care, self-development, and tolerance, drugs will not win in these spaces, and dependencies in general will not win in the spaces. Regarding parental skills, um, we need to the authoritative, which is the parental model, that where we are very present, we are there for sure. So different from being a controller, You are present in a participative way with clear limits given to our child or teenager, usually reduces the probability of addiction behaviors, in the sense that when parents are able to develop this parental skill, what we know is that the other drugs and the other addictions are much more related to psychiatric comorbidities, or are much more related to childhood trauma than necessarily do. And even so, people exposed, children and teenagers exposed to trauma or difficulties, vulnerabilities, social, economical difficulties and vulnerabilities, and other situations of vulnerabilities, when they are taken care of, when they taken care of by a family that are warm, affectionate, and are able to give the necessary limits for self-regulation, our nature is impressive. Our resilience always wins in these cases. Okay, so I'm reaching a conclusion. You will have access to this lecture that was provided for Freemind. I have run out of time, but I'd like to show you that yes, there are some behavioral theories in which teenagers, about these behavior of teenagers that are silent behaviors, and no work that were consulted for this presentation mentioned a lot distancing due to the large exposure of the parents to electronic means. So from one side, you have teenagers and children accessing more platforms. Several studies focused on the parents as people that are disconnected also, due to how we were also absorbed by our work and how are regulating our lives. So teenagers are, left alone, regulating their lives in the social networks and that the world that emerges therefrom. And collaborative monitoring is necessary. These limits need to be negotiated. Um for this current society, those old limits associated to punishment, they don't work anymore. Punishment does not, I don't know if it ever worked, but it does not work for sure today. Punishment is not, uh, does not lead to results anymore. And so we really need to develop strategies. Older literature calls them skills. Today we call them strategies to reduce social stress, modulate intense emotions, improve group interrelationship. It's extremely important to take to today to think of the health of the family, all the members of the family, because it's a connection that has to happen of all the members of the family, and a change of behavior that involves everyone in the family and not only the teenager that needs this type of control. So, taking care of emotional proximity without being invasive, with respect, negotiations, approaches that are recommended, open questions always. I'm not going to talk too much about this now because you still have several of these tips being given by the other lecturers.
But then I'd like to end this presentation saying that at this moment, what's new is something that's old for us. The more connection and attachment and warmth I have, I can manage better difficult situations. If I'm not able to establish a bond, if I'm not able to get closer, and if the good moments are not really good, the bad moments will be very bad, because I must make use of the good moments to be able to, in difficult times, be an authority and contain my son if he needs it. If I'm not producing good creative moments, if I'm not bonding and generating memories, I will not be able, at a difficult time, I won't be able to do much because I do not have authority, presence, experience, nor the skill to deal with the person with whom I do not know how to deal with because it's an unknown person, even though it is my son. So it's about organized bond. It's not being invasive. It's being connected. So I'm sorry. I'm sorry. Thank you very much. I'm sorry for extending myself. Thank you. Excellent. Well, without further ado, our next speaker is a psychologist. She has an MA by Unopar. She's the coordinator of the cognitive behavioral therapy from the University of Brasilia. She's an expert in neuroscience and in child psychology. She's a licensed facilitator of the educational program Positiva and co-author of the books Manual of Education, Parenting Education, and Affection Transforms. She will talk about family relationship and the use of screens, impacts, connections, and disconnections, as well as strategies within the family context. A round of applause for Professor Luciene Alves. Good morning. I'm glad you are here, and I'm glad I'm here as well. Thank you very much. Sueli, I think what I'm going to say agrees with what you said. They're very aligned. It's aligned with the issue of parental guidance because I'm going to talk about a little bit about that today. So here I brought you a selection of my MA thesis, the book that used to be my MA thesis, and based on some research and also based on my clinical experience with research, theoretical basis, and scientific evidence. So here I invite you to think and to reflect about this question. Have you seen my charger? I imagine that you, when you came here, before you came here, you got organized. You organized yourselves, and you thought about a few things. The first one, your mobile phone, work, your activities, and the other thing you thought about was your charger. Some of you already sit next to places where you can charge your phone because today we use our mobile phones for everything, right? And we use our phone to work, to bring evidence, photos, to look for location and other activities. So today we must think about the place of mobile devices in family relationships and the challenges of parenting. Dr. Sueli spoke about thinking about our family, and that's the point. And when I have children and teenagers in my office, and when I see the parents, they say the following: my son is overusing mobile phones. They use their mobile phones a lot. He stays a long time on the computer playing. But we also must think about that and think about that behavior. Why that kid is spending so much time on their mobile phones? Why they stay such a long time playing games? What this indicates in terms of behavior. If my child does not talk to me, what does that mean? These are some issues and thoughts, reflections that we must do based on family dynamics as well, and studying a little bit more about the issue of family relationship and the use of technology. These studies talked about technoference. Who has heard of technoference? Yes, no. Technoference comes from the issue of technology, but the interference of technology related to interpersonal relationships and family relationships as well. That is, it refers to the interruption or disturbance of daily interpersonal communication and of shared time caused by mobile and digital devices. When you go out to have lunch or to do an activity, especially in our leisure time, do we put our mobile phone aside and truly use that moment to be present? Truly, very often, no, we don't. And in the family context, this begins to affect because the technological interference, it refers to the interruptions and in the interactions among parents and children due to the use of mobile devices, screens, mobile phones, games, etc. So we must think about that. But of course, since we adults, we use it, teenagers use them as well. And what's important is to understand how this interferes in our family relationships and family dynamics, because this can be used in a functional way. It can be useful, of course, but it can also bring significant harm, which is what the literature brings to us. So there are studies that already show that the problematic use of technology by parents influences the problematic use by children. So when we study children development, we think about the stages of development. And children learn a lot through repetition, through modeling. And if I'm there excessively having a behavior depending on the age of the child, especially in the first and second child, especially in early childhood, they will reproduce that behavior. The same works for teenagers. But how they will reproduce that? How is this response taking place? And of course, not only with children, but the problematic use of technology among teenagers. So parents, depending on the parental styles, which I will talk about briefly, they also influence significantly the issue of family relationship and the impact of the use of technology. So very briefly, I have here 4 parenting styles, which is authoritarian, which is related to the issue of punishment. There is a distancing that takes place. It's a more punishment-based style, and that style in which parents end up having more presence in the family. There is the indulgent or passive one. There is this style that has a low demand and a high responsiveness and expression of feelings, and they're also more permissive. And within this style and researching, some authors say that permissive parents do not set boundaries to and limits to the use of technology, to the use of screens, to the use of mobile phones. So uh, there will be no limits to that for teenagers and children. I say children because we see that children, unfortunately, they too end up having access to these devices and using them in a dysfunctional way. There's the negligent, in which we have low responsiveness and low demonstration of feelings, demonstration of affection, which is very worrisome. And authoritative, which is that parents are present, they set limits, they set boundaries, they they have established connection in a more healthy way. So when I say parents, each one has a parenting style. And within right evaluation, within psychotherapy, we will understand what's the most predominant style among parents. Maybe the father is more passive and the mother is more authoritarian, or the other way around, or more negligent. So the goal is to align based on parental skills and strategies. The idea is to align these styles. And most importantly, make these parents aware of their parental skills and styles. So to make what I'm saying more evident, I brought a clinical case here. The idea is to reflect, okay, is to promote a reflection, to talk about maybe research more the impact of these relationships between parents and technology. So this case illustrates what we are experiencing today regarding the use of screens. So the excessive use of screens and the relationship impact. So here's the patient, a teenager, 12 years old. It's a boy, mother, parental style, authoritarian, and the father's style is more passive. Why they sought advice? Because the son uses his mobile phone excessively in a dysfunctional manner. He stays in his room all the time. There's no open communication, active communication with the parents. But this model, it didn't used to be like that. It became like that. And within the process of getting to know the case, it was identified that the mother used her mobile phone excessively, computer as well, because she works at home. She's a home-based worker. She works in home office. So there was a dynamic in the family. So teenager from a certain point on, like 2 3 years ago, when the mother started to work from home, he began to play more online and have access to social media. And the mother reports the difficulty to set limits because the son is isolated in his room. Why establish limits? Because the authoritarian style will try to have a more punitive approach. In other words, to remove what is excessively being used. But removing, is it the best way? Maybe not. If I get here and get your mobile phones and put them until 6 p.m. here with me, probably you will have a more reactive behavior, right? So it would not be nice. It would not be good. So if I tell you, just leave your mobile phone aside for 5 minutes, it might generate a certain anxiety. Okay, that might happen. But what I mean here, I mean that we also need to look at teenagers as a person who has their emotional issues, have their own behaviors, have their own difficulties, and pay attention to that. And considering that is extremely important. So what the teenagers said regarding that situation: my mother prefers to stay watching videos than look at me. Visual eye contact. What does that show? Eye contact shows affection, connection, attention, active listening. So this is very important. I prefer to stay in my room than with everyone in the living room without talking. Okay, everyone, this is not, maybe it's not a situation of watching a film, but each one is in sitting in his own place using uh, their mobile phones or watching a video. It seems that no one notices when I'm there. That is, that kid becomes invisible. And obviously, that behavior and family dynamics will bring about affective distancing, a lack of connection. And then the mother says, I don't recognize my child anymore. And how will things go on from then on?
And then some interventions made. Of course, the study of a clinical case is a cutoff, there are several other interventions, questions, issues related to, for example, psychotherapy or parental guidance. This is just a specific scenario, okay? So of course the guidance was for parental guidance, and how would this affect the familial relationship, because the parental skill is how children create their children and the marks of development. So, flexibilizing this more authoritative practice, because when you have this parental style of being more authoritative, it's a bit more difficult to be flexible. When I say flexible, I'm talking about building a new comprehension on the dynamic on that specific phenomenon. So, because people are a bit more rigid, because a more authoritative parental style also involves having greater control regarding the dynamics, regarding the family, the other, or what the person needs. So promoting coherence among between rules and behaviors of adults. That was a very crucial point. Of course, making the teenager understand the family dynamics, that the family has a way of working, a way of operating, functioning, and that it might this type of way of the family functioning can be better improved, and micro actions of reconnection in the family. This calendar is in my book, so it's an activity that I already put in practice with some patients within a parental guidance method. And why micro actions? Because sometimes we have the idea that, oh, I want to change. I want to change. I want my teenager child, my teenager daughter or son starts talking to me. It's not like that. But we can think of strategies that can contribute for this relationship. Build an interesting strategy. So create rules regarding screens together, having the parents participate. So it's not like removing completely the cell phone, but guiding, informing the teenager about the use of cell phones, uh, so that it will he the talk about the purpose and the functionality of that tool, because it's a tool. So I have a scheme here that I created first. So a 10-minute conversation without having the screens on when you're talking. Of course, if you make the teenagers talk to their parents for an hour, depending on the teenager, it will be difficult for sure. So we have to go from the least complex to the most complex, because if I'm able to talk for 10 minutes, the likelihood of being able to talk for 12 minutes is greater, is higher, 15 minutes higher, 20, until we have more significative qualitative. Prepare lunch, prepare snacks together. So the idea here it has to be something like miraculous or something wow, no. But each day of the week, put a small task. It's more about quality. It's about reconnection and time. So defining together use screen. So you're going from a style that is authoritative. So you only uh, use your screen time is something that we're going to agree on, okay? And that will work better. We have to compliment, we have to validate the teenager so you are able to talk, validate that time. And this validation is so important. It's as important as being present because presence needs to have a purpose, an intention in the family relationship. So, very briefly, the results. So, the mother says here in this case that the gradual reduction of her own screen time, more emotional presence. So, here we're working with parental skills. So, the teenager will spend greater time in the common areas of the home and shows greater openness to talk. So, having openness is a gain, and those are the what my that's what the mother said. My son is smiling more. He's talking about school without me having to ask. And I also noticed that when I put my cell phone away, my son will talk to me. So here's a sentence. Small digital pauses strengthen bonds and genuine presence. Thank you. Thank you, Professor Lucieni. If you're the father or a mother of a teenager or are very close to a teenager, for sure identified to the professor's talk. Our international guest graduated in the University of Lincolnshire in Humberside Hall campus in social service. And when he was in England, she worked at Cornhouse, Berkshire, Start, Homestart, Hull, Ravenswood, and so on. Since 2008, she's the scientific director of the Prevention Centers on dependency and promotion of psychosocial health serious. In 2020, she earned her master's degree in penal right and addiction from the University of the Salonic Aristoteles. Her theory was centered in the experiences about prisoners in the therapeutic community, the independent of Kathy, and I'm sorry about the pronunciation, talking about the importance of therapy instead of prison for uh, people that are addicted to some type of substance. She is a member of the ISUP Greece. She has helped participate and organize several conferences. The European Conference on Prevention 2018 and so on. She's also a trainer certified in social work, workforce in Europe and Central Asia, and also INEP Plus. So Natalia Zakaski, please, the floor is yours. A round of applause for her.
Very good. So, hello. Ah, yes. Oh, ready?
20 minutos, gente. Começou aqui com 18, comeram 2 minutos dela.
Somebody stole me 2 minutes, but
Yeah.
I will try to be quick. Okay. So, as you heard, all that title, but also I have another title that is never mentioned. I am the proud and sometimes very, very exhausted mother of two teenagers, a girl and a boy. So this speech today doesn't only speak to me as a professional, but as a person as well, because we do carry both roles, all of us. So before we dive into our subject, I would like to clarify a couple of things about puberty. First of all, the girls started around 10, the boys started around 12. I will not elaborate on why, you all know why. And also with puberty comes changes. There comes the changes in themselves. Children feel differently. They have emotions that they never had before. They have urges that they never had before. And also they have visible changes such as hair growth. Ugh. So, and with these changes, we have some emotions that accompany uh, this time um, of adolescence. And the two emotions, the new emotions, are guilt and shame. Guilt is, oh my God, I did something wrong. And shame is, what do you think? What is the question of shame? Exactly. What somebody else is going to think of me. So they're very ashamed, and they're two very, very strong emotions. So if we agree on that, we need to see that puberty comes with a sudden package of self-awareness, right? And teenagers start to feel judged and they start to feel the epicenter of everything. If they have a little spot on their face, they feel that everybody is looking at that spot. It's not true, but this is how they feel. And also, it's the time where they start to try and demolish the authoritarian figures. So within these authoritarian figures, we are the first ones that they want to demolish. Parents, very authoritarian figures. We tell them what to do because we know better. And it's the time that they form their identity. And there are three types of identity. One is who I am, who I think I am. The second one is who others think I am. And the third one is who I would like to be. So these are the three types of identity that adolescents have, and it's the time that they really, really want to start to take initiatives, to start to take their lives into their own hands, and they also want to be autonomous, obviously. And with that need comes the need to be different from their authoritarian figures, from their parents. Remember how we were as adolescents. We were exactly the same. Yes, okay, I agree completely with what you said, and there's like the societies are different, the means are different, we have access to more things and access to different things, but deep down, puberty is the same, okay? So now we have a major clash in interests within the household. Kids want to be autonomous, they want to take their lives in their hands, and we are trying to keep them as close as possible and as controlled as possible because we feel that this is it's going to keep them safe. It's not, but this is what we feel. And this is where communication has a huge problem. And the one single problem with communication is the illusion that it has taken place. We may speak together. I say what I want, you tell me what you want, but I cannot guarantee you that we communicated. I cannot guarantee you that we all leave this place and we have all understood the same thing. So it's our job, it's the job of the receiver and what's the other word? Receiver and deliverer, thank you. So this is one barrier, language. The receiver and the deliverer to make sure that we both understand each other. And this is what we need to develop with our children. So what do you think? I will pass on this microphone, okay? And there are no right or wrong answers. what do you think is a major problem with communication with our adolescents? Who here has an adolescent? 10 onwards, sometimes maybe 25. Okay. So what do you think that maybe is a major problem with communicating with our adolescents? What would you think that a barrier of communication would be? Sorry? Language. Very good. And not only because I speak Greek and you speak Portuguese, but language is different between adolescents and us. We do not speak the same language. They have expressions that we do not understand. So one of them is language. We need to understand. We need to be educated about what they mean. Very good. Another barrier. Listening to each other. Very good. But we do have ears. We do listen. But do we really listen? Hold that thought. Yes. Ah, they don't care. Whatever. This is something we hear very often, isn't it? Oh, whatever. Yes. So, listening. We will come to that. Well, how do we listen? It's very easy to hear someone. Hearing and listening are two completely different things. We hear everything, but do we really listen? How do we listen? There is this scientific um, word called active listening. What is active listening? Active listening is when we try to listen with all our heart. When we don't listen with our mind, but we listen with our heart, which means that what we are trying to actually see and what we are trying to look at is not what is being said, but what is the emotion behind what is being said. I will give you an easier example. So when our kids are little, they play. Okay, so at some point they try to I don't know, fix a little train. So when they get really at some point, what we hear is that they take the train and they throw it and they break something. What we see is the result. The train was thrown, something broke. So maybe we're going to have a difficult conversation with them, or maybe we're going to tell them off because what they did was wrong. But what we really need to see is what motivated that hand to throw the train. And the emotion might be frustration. So we need to see what is the emotion behind what is being said. Identifying the emotions is paramount, is of paramount importance, not only when we listen to others, but also when we talk to others. We need to be very aware of what we feel about the person or about the moment when we try to communicate something. So when we're angry, most of the times, what we communicate are words that often don't, the goal is not to say what we want, but the goal is to hurt the other person, or the goal is to take this off our chest. And there is no meaning to this. So that's not communication, really. Another barrier are orders. As parents, we are designed to give orders, solutions, we're programmed. We have orders, solutions, and ready-made solutions, maybe threats, as you said, punishment that is not working. It is not working 100%. We criticize often. We maybe blame. We may also laugh and make jokes about what is being said because maybe we don't think it's important enough. But really, what we are communicating then, there and then, is that what you're telling me is not important enough. So, in order for us to be able to create a bridge with our teenage sons and daughters, we need to be able to listen. And when they say whatever or we don't care, it's not that they don't care, it's that they feel that they are not being really, really heard. So, what do we need? First of all, we need time. What do we mean by time? Whenever you come to talk, whenever our teenage son or daughter come to talk to us, we make time. We don't wash the dishes at the same time. We don't look at our phones at the same time. We don't answer the phone that is ringing in the middle of what is being said. We are 100% there and then with them, trying to listen of what is being told. So we make time. We create a safe place. We create the place that they feel that they are heard and not judged. And this is not easy, obviously, because they're our kids, and some things we are not able to listen to. You know, there are difficult things that might be said, but then time is of essence to us as well. We have the right to ask for time to process what we heard before we start the conversation with our kids. Also, we need to make clear of our expectations and our boundaries. Being close to our children doesn't mean that we're friends. Children have friends. They need parents. So being there for them, being open with them, creating the environment that they can be heard, being active listeners doesn't mean that we don't set boundaries, doesn't mean that everything is on the table. And it doesn't also mean that we don't have expectations from them, as long as they are not many and very, very clear. And when we share, it's very good that we can, if we can share with them. We have our personal histories. Share, don't overshare. There are certain things that they don't need to know. But when we share, try to share your emotions, not the situations. How did you feel at their age? What was difficult for you at their age? Remember and create that bridge that will make them feel that they're not little aliens compared to you. And remember that parenthood does not mean perfection. We don't have to be perfect parents. I don't know if there is such a thing as a perfect parent. I'm sure there isn't, but So we don't need to be perfect. We need to be honest. In the majority of times when our kids are asking us something, they are not asking because they want to know the answer. They already know the answer. They're asking because they want to check if we're going to tell them what they already know. Because when you're there and when you're not seeing them, they observe you. They see you all the time. They know you better than you know them. And they change. They change a lot during puberty. I remember that I was reading about this. I had many, many friends that were telling me this, but I thought they were exaggerating. So when my son, in the summer of the 6th grade, going to the 1st grade of high school, he changed to a completely different person. I literally didn't know who he was. I was raising someone for 12 years, and then there was this person in front of me that was someone else's, probably his father's son. So I asked him, I told him actually, because I struggled so much. I struggled so much to communicate with him because I was stuck in the old way of communication when he was younger. So I said to him that I really, really need to know you again. I'm sorry, but we need to reintroduce ourselves from the beginning. Again, who are you? What do you want from me? What do you expect from me? Because they do have expectations as well, and we have to listen to these expectations. So what do you want from me? What do I want from you? And at some point, he was angry all the time, which was very weird for me as well. So at some point, he described in very good words and very scary words for mom how he was feeling. And he told me, I'm feeling like something is dying inside me. I don't know what it is. I don't know why I feel like this. And I always want to shout and cry. I was really scared. But in reality, what he was telling me was the exact truth. His child self was dying, and we were there. He was a little bit of a phoenix, like every teenager, and they were resurrecting from the ashes of their child's self. What we need to do is be there, be patient, very patient, be consistent, be steady, take a breath. It's only 5 to 6 years. It's going to go away at some point. And keep listening with your heart. But most of all, try to keep calm and be human. Thank you so much.
Thank you very much. Oops. Muito bom.
Very good, excellent. I'm so too bad that we don't have much time. Now we will move on to our last speaker. Now we will receive the Executive Secretary of Strategic Management of the Federal District Government Secretariat. She has a BA in Administration, Pedagogy, Postgraduation Management. She's a MA in Business Administration. She's a professor and educational guide counselor. She's a leader of the Committee of Education of the group Women of Brazil and counselor of the Board of Education of the Federal District. MA Sueli Rodrigues de Souza. Round of applause. Good morning. It's a huge pleasure to be here with you today. Today I represent the Secretariat of Government, which is the MAYU Secretariat. It coordinates all the other secretariats so that they can score. So we follow up all government public policies. We participate in all managements with other secretariats. Today we are here and we have made available to our team 400 invitations. All secretariats are participating in this event. SED, SEDEST, Secretariat of Education, Secretariat of Health, of Public Safety, SEJUS, Justice Secretariat, Youth Secretariat, and Women's Secretariat. We understand that it's extremely important the government to participate in such an important congress such as Freemind Congress so that everyone can understand what we can do for the other. And today, talking about parental skills, we're going to talk about the management that the government has been offering to the population. We have worked in the government, all that public management part, governance, risk management, strategic planning, in the 35 managements of because we take care of all of them because people must understand that the other is more important than anything else. We must always, Alessandra spoke very well We must have direct contact to understand the worries and know what the population needs and hear the population, listen to the population. So that's why my executive secretariat, which is a strategic management secretariat, takes care of the 35 sub-managements, and we work with them. Strategic planning, risk management, governance, harassment, which is something that's very important because we need to have this caring eye towards the other. So,
So we will talk about prevention, promotion, starting with prevention and promotion. Prevention programs will speak within a context of what exists in Brazilian law, and then I'll come specifically to the federal district, the use of programs based on scientific evidence and families, such as Famílias Fortes and Tamo Junto, which is a federal government action. Could you please resize the screen? It's out of proportion. Okay, I'll read it from my cell phone. Yeah, when it's live, these type of things happen. Yeah. So let's continue. So as I said, a prevention and evidence program from the federal government, then the intersectorial aspect of it, which is the articulation among different sectors, such as health, education, social assistance, social work, and it is crucial to integrate actions and agenda 2030. These actions need to be very broad and very well articulated among all sectors, and reduction of loss of harm, which is implementing strategies and reducing harms losses regarding uh, addictions, drug addictions, to reduce the negative consequence of the users to the users. And now, could you please put the slide on the screen, please? So, to face, tackle, and go through treatment. It's kind of complicated to, well, anyway, it's live, so it's okay. Better now. Thank you. Let's see if it works now. Okay, a bit more. Let's see if it gets better. Prevention. Now the screen is big. Well, tackling the problem and treating the problem. Well, tackling and treating the problem, we have the psychosocial service network, a set of services to ensure complete and seamless service to people with mental disorders and users of alcohol and drugs. So the actions are all interconnected. So we have the psychosocial service centers with multi-professional humanized intake and service, and it's open doors. It's completely open doors. You know, we cannot force anyone. So everyone who wants to, who makes this effort or this goes toward this direction, doors are open. Strategies to promote independence, the exercise of citizenship, and social reinsertion with that have been too long admitted to some type of in-house treatment. better. Thank you. So psychosocial servicing the families. Who are the families are those that suffer the most? When we have a case like this in our family, we just completely lose track. And when we lose track, we need help from professionals, from the government, from institutions. And these services that offer support to the family to strengthen bonds and prevent relapses, and attention on primary care, mental health actions, prioritizing primary care, primary treatment, and making it easier to access and to continually be treated. But we have challenges, of course. We have challenges that because the government alone cannot handle it all. We need help from the third sector. Third sector needs to be strong and together, and one helps the other. It's a two-way street. And what are these challenges? Funding and lack of infrastructure, social stigma, lack of qualified professional, trained professional, uncertainties in the community, lack of consensus, lack of agreement in community, resistance to changes, and resistance to new environments and to new challenges. When you talk about lack of infrastructure or not enough funding, these two problems can compromise the quality and the reach of the offered services, especially in towns with less funding. So there are towns that they try to but are not able to do anything. And social stigma is prejudice and discrimination against people with mental disorders or that are drug addicts. We had this really big difficulty in Brasilia, in Taguatinga, which is one of the districts surrounding Brasilia, or when we were serving peoples that were on the streets, vulnerable, and the community there did not accept it. Prejudice is something cruel. People do not want to lose their comfort, their well-being to help the other. This is something we notice that happens a lot, and we're not able to help the way we should. Not enough skilled professionals, a lack of skilled professionals, or a lack of qualified training for the workforce that acts in this field is also an obstacle for some people. Sometimes people are not capable or they are disgusted. Oh no, this person is using drugs. She'll always use it. She's living on the street. She will always live on the streets. But we need to be empathic to the other to be able to reach our goal. And the lack of clarity in reaching an agreement, in communicating the strategic agenda, can lead to misinformation when implementing public policies. That's the most severe case. Sometimes the government wants to enforce a public policy and it's not accepted by the community. We also have resistance to change, the lack or laws that are too old, that make no sense anymore, making it hard to adapt and modernize public policies to the current needs of society. So we have problems in specific environments. People want uh, people want that these houses to serve these people are very far away from where they live. Oh, why do you have to put it in Taguatinga? Why don't you put it at Santo Antônio do Descoberto? So, have putting the human being with a problem, making this human being be very far away from you, that is also something that affects serving well. And we have some programs in the federal district And if you could please put it on the slide, because we have psychosocial actions within the health secretariat, and we have some colleagues here who will also be part of panels that will talk specifically about their panel. We have a panelist from the education secretariat and another one from the security and safety secretariat. Here we have some services and programs from the health secretariat, interactive practices on health. We call it PIS, which includes modalities as acupuncture, meditation, yoga, Reiki, music therapy, physiotherapy, promoting collective well-being. This is always happens at the UBSs, which are the health centers, the health units. Each region we call administrative region, and each one of this administrative region has an UBS with this type of service. Public policy that was launched for the federal district's public servants for their well-being, prevention, and care of their mental health. This was created because of the huge number of people that were having depression, burnout. So this program was created so that these public servants can have reduce their stress caused by their work. We have also a social service. This all within the health secretariat. So social service offering guidance and forwarding the users to access social and social services, assistance services, and we also have the we have the CAPS, which are the Centers for Psychosocial Service. We have IPSs, with this also the primary care within mental health. Also, we also have the emergency room centers also, which are called UPAs. Okay. So let me go back a bit. We also have this beauty in Brasilia, which are the ipê trees. We have them in yellow, also blue, purple. So we have also sedges, which are the centers of reference for social assistance, CRAS, which offers basic services for social protection. And in each administrative region has a CRAS, also a reference center for social services, CREA, which serves people that are having their rights violated. We have also a center to strengthen bonds and relationships, CCCFV, that develops activities to strengthen social and family bonds. We have also OP, which is a specialized service for population living on the streets. We also have services and benefits with other programs of income transfer. SETSDF administer the Bolsa Familia program, which offers benefits, income transfers for families in vulnerability and vulnerable conditions. Incentiva DF, which supports uh, cultural projects for youth in situations of vulnerability, and also humanized intake services. Now we have in Brasilia, very recently, we launched the social hotel, and we have the committee which is organized by the the civil office of the federal government, and all the secretariats, SEGES, Public Safety, the federal government, Sejus, the labor secretariat, education secretariat, health secretariat, all of these secretariats and the federal government work together for this population to leave the streets, but the population needs to want that also. And psychosocial service, we have program for people that are victims of violence, which is the Viva Flor program that focus on the service and humanized intake of women that are suffer domestic violence, acting directly with these women.
Entering in this program may occur through the decision of a judge or administrative act of police authorities according to a decision of law enforcement agencies. We also have programs for public safety workers, which is the QVT 360, which aims to promote the full wealth and well-being of law enforcement officers, fighting stress, depression, and other psychological changes. Today we have an agreement with the S system in which we cater to the entire military police and we offer psychological counseling because they are always under great stress. And in the education secretariat, the education department, we have the humanized intake individual program for these students aimed at students of public education to offer individual counseling and promote self-care and well-being of professionals. So in this case, these are for professionals. We have other, Ana Beatriz will talk about that in her talk. So, Psychosocial Attention Network, Health in Schools program, which is a collaboration with schools to offer support to mental health, including the activity of psychosocial activities, psychoeducational activities that help students deal with their emotions and also promote the involvement of the families and initiatives in schools. We have today the Namoral program, which is a wonderful program that is making us very happy and making our students very happy. So, and then we have another program aimed at law enforcement professionals that deal with domestic violence. Let me get back a little bit. And Sejus, which is a Justice and Citizenship Department that has a program Acolhe DF, Direito Delas, Viver 60 Mais, Nasce uma Estrela, Protagonista da Casa, program that protects the victims of violence and that protects teenagers and children. So I'd like to say that in addition to these programs, that the government also has partner programs. We have been expanding all the services that are offered to third sector institutions, and we also have some actions and programs. This week we signed new agreements with the Department of Education and Safety that these programs will cater to the population even more. Thank you very much. I'm sorry for the technical issues. Hello, Sueli, your mobile phone. Thank you very much. We'll now end this panel on parental skills. Excuse me? Yes, I'm going to talk about that. Due to time, because if we delay one panel, we end up delaying the entire schedule. So what I have arranged with the events coordination, we have some tables downstairs. I will ask the ladies to sit there in those tables, and whoever has questions or would like to talk to them, you can do that on that table. Is it okay? So that we will not delay the next panel. Okay, then. Natalia would like to thank the interpreters who are doing this translation for this event. And thank everybody that's doing the translation, the boys here who are organizing the slides. So thank you. So a round of applause for technicians as well. And now we end our third panel. So the ladies, our colleagues will stay. But before, let's take a picture, please, before you go downstairs.